Balance and the core. Given the importance of balance and the condition of the core musculature to fitness and overall quality of life, these baseline assessments can be collected to evaluate the need for comprehensive balance training and core conditioning during the early stages of a conditioning program. While dynamic balance correlates more closely with people's daily activities, these tests are generally movement specific and quite complex. Consequently, trainers should aim to first evaluate the basic level of static balance that a client exhibits by using the sharpened Romberg test or the Stork stand balance test. Figure 7-47 can be used to record the client's performance on balance assessments presented in this chapter. Sharpened Romberg test. Objective: to assess static balance by standing with a reduced base of support while removing visual sensory information. Equipment: a flat non-slip surface and a stopwatch. Instructions: explain the purpose of the test. Instruct the client to remove his or her shoes and stand with one foot directly in front of the other. Tandem or heel-toe position with the eyes open. Ask the client to fold his or her arms across the chest, touching each hand to the opposite shoulder. Allow sufficient practice trials. Once the client feels stable, instruct the client to close his or her eyes. Start the stopwatch to begin the test. Always stand in close proximity as a precaution to prevent falling. Continue the test for 60 seconds or until the client exhibits any test termination cues, as listed in the observation section. Allow up to 2 trials per leg position and record the best performance on each side. Observations. Continue to time the client's performance until one of the following occurs. The client loses postural control and balance, the client's feet move on the floor, the client's eyes open, the client's arms move from the folded position, or the client exceeds 60 seconds with good postural control. General interpretations. The client needs to maintain his or her balance with good postural control without excessive swaying and not exhibit any of the test termination criteria for 30 or more seconds. The inability to reach 30 seconds is indicative of inadequate static balance and postural control. Stork stand balance test. Objective: to assess static balance by standing on one foot in a modified stork stand position. Equipment: flat non-slip surface. Stopwatch. Instructions: explain the purpose of the test. Ask the client to remove his or her shoes and stand with feet together, hands on the hips. Instruct the client to raise one foot off the ground and bring that foot to lightly touch the inside of the stance leg just below the knee. The client must raise the heel of the stance foot off the floor and balance on the ball of the foot. Stand behind the client for support if needed. Allow 1 minute of practice trials. After the practice trial, perform the test starting the stopwatch as the heel lifts off the floor. The test is performed with the eyes open. Repeat with the opposite leg. Allow up to 3 trials per leg position and record the best performance on each side. Observations. Timing stops when any of the following occurs. The hands come off the hips. The stance or supporting foot inverts, everts, or moves in any direction. Any part of the elevated foot loses contact with the stance leg. The heel of the stance leg touches the floor. The client loses balance. General interpretation. Use the information provided in Table 7-19 to categorize the client's performance. Table 7-19, the Stork stand balance test. Males, greater than 50 seconds, excellent. 41 to 50 seconds, good. 31 to 40 seconds, average. 20 to 30 seconds, fair. Less than 20 seconds, poor. Females, greater than 30 seconds, excellent. 25 to 30 seconds, good. 16 to 24 seconds, average. 10 to 15 seconds, fair. Less than 10 seconds, poor. Miguels Torso Musculature Endurance Test Battery. Miguels Torso Muscular Endurance Test Battery. There is more to abdominal tone and core stability than showing off a six-pack. Possessing a strong core is important when performing simple ADL like lifting a heavy laundry basket or recreational activities like swinging a golf club. Core stability involves complex movement patterns that continually change as a function of the three-dimensional torque needed to support the various positions of the body. Even back pain and dysfunction can be reversed by having a strong core. Dr. Stuart McGill states that back problems can often be alleviated by improving and then grooving the motor patterns of abdominal musculature. To evaluate balanced core strength and stability, it is important to assess all sides of the torso. The true benefit of each one of the following tests is in the assessment of the interrelationships among the results of the three torso tests. In other words, the tests are performed individually, but then evaluated collectively. Poor endurance capacity of the torso muscles or an imbalance between these three muscle groups is believed to contribute to low back dysfunction and core instability. Trunk Flexor Endurance Test. The Flexor Endurance Test is the first in the battery of 3 tests that assess muscular endurance of the deep core muscles, i.e. transverse abdominis, quadratus laborum, and erector spinae. It is a time test involving a static isometric contraction of the anterior muscles, stabilizing the spine until the individual exhibits fatigue and can no longer hold the assumed position. Contraindications. This test may not be suitable for individuals who suffer from low back pain, have had recent back surgery, and/or are in the midst of an acute low back flare-up. Equipment. Stopwatch, a board or step, and a strap, optional. Pre-test procedure. After explaining the purpose of the Flexor Endurance Test, describe the proper body position. The starting position requires the client to be seated with the hips and knees bent to 90 degrees, aligning the hips and knees and second toe. Instruct the client to fold his or her arms across the chest, touching each hand to the opposite shoulder. Lean against the board positioned at a 60-degree incline and keep the head in a neutral position. It is important to ask the client to press the shoulders into the board and maintain this open position throughout the test after the board is removed. Instruct the client to engage the abdominals to maintain a flat to neutral spine. The back should never be allowed to arch during the test. The trainer can anchor the toes under a strap or manually stabilize the feet if necessary. The goal of the test is to hold this 60-degree position for as long as possible without the benefit of the back support. Encourage the client to practice this position prior to attempting the test. Test protocol and administration. The trainer starts the stopwatch as he or she moves the board about 4 inches or 10 centimeters back, while the client maintains the 60-degree suspended position. Terminate the test when there is a noticeable change in the trunk position. Watch for a deviation from the neutral spine, i.e. the shoulders rounding forward or an increase in low back arch. No part of the back should touch the backrest. Record the client's time on the testing form. Trunk Lateral Endurance Test. The Trunk Lateral Endurance Test, also called the Side Bridge Test, assesses muscular endurance of the lateral core muscles, i.e. transverse abdominis, obliques, quadratus laborum, and erector spinae. Similar to the Trunk Flexor Endurance Test, this time test involves static isometric contractions of the lateral muscles on each side of the trunk that stabilize the spine. Contraindications. This test may not be suitable for individuals with shoulder pain or weakness, who suffer from low back pain, who have had a recent back surgery, and/or are in the midst of an acute low back flare-up. The equipment needed is a stopwatch and a mat. Pre-test procedure. After explaining the purpose of this test, describe the proper body position. The starting position requires the client to be on his or her side with extended legs, aligning the feet on top of each other or in tandem position heel to toe. Have the client place the lower arm under the body and the upper arm on the side of the body. When the client is ready, instruct him or her to assume a full side bridge position, keeping both legs extended and the sides of the feet on the floor. The elbow of the lower arm should be positioned directly under the shoulder with the forearm facing outward. The forearm can be placed palm down for balance and support. and the upper arm should be resting alongside of the body or across the chest to the opposite shoulder. The hips should be elevated off the mat, and the body should be in straight alignment, i.e. head, neck, torso, hips, and legs. The torso should only be supported by the client's foot or feet and the elbow forearm of the lower arm. The goal of the test is to hold this position for as long as possible. Once the client breaks the position, the test is terminated. Encourage the client to practice this position prior to attempting the test. Test protocol and administration. The trainer starts the stopwatch as the client moves into the side bridge position. Terminate the test when there is a noticeable change in the trunk position, a deviation from neutral spine, i.e. the hips dropping downward, and the hips shifting forward or backward in an effort to maintain balance and stability. Record the client's time on the testing form. Repeat the test on the opposite side and record this value on the testing form. Trunk Extensor Endurance Test. The trunk extensor endurance test is generally used to assess muscular endurance of the torso extensor muscles, i.e. erector spinae, longissimus, iliocostalis, and multifidi. This is a timed test involving a static isometric contraction of the trunk extensor muscles that stabilize the spine. Contraindications: this test may not be suitable for a client with major strength deficiencies where the individual cannot even lift the torso from a forward flex position to a neutral position, a client with high body mass, in which case it would be difficult for the trainer to support the client's suspended upper body weight, individuals who suffer from low back pain, have had recent back surgery, and/or are in the midst of an acute low back flare-up. Equipment: elevated sturdy exam table, a nylon strap, and a stopwatch. Pre-test procedure. After explaining the purpose of the test, explain the proper body position. The starting position requires the client to be prone, positioning the iliac crest at the table edge while supporting the upper extremity on the arms, which are placed on the floor or on a riser. While the client is supporting the weight of his or her upper body, anchor the client's lower legs to the table using a strap. If a strap is not used, the trainer will have to use his or her own body weight to stabilize the client's legs. The goal of the test is to avoid horizontal prone position for as long as possible. The goal of the test is to hold a horizontal prone position for as long as possible. Once the client falls below horizontal, the test is terminated. Encourage the client to practice this position prior to attempting the test. Test protocol and administration. When ready, the client lifts and extends the torso until it is parallel with the floor with his or her arms crossed over the chest. Start the stopwatch as soon as the client assumes this position. Terminate the test when the client can no longer maintain the position. Record the client's time on the testing form. After completing all elements of Miguels Torso Muscular Endurance Test Battery, personal trainers can use Figure 7-54 to record the client's data. Some of the ratios listed. Ratio of flexion to extension. Criteria for good relationship between muscles is a ratio less than 1.0. Right side bridge compared to left side bridge. Scores should be no greater than that of 0.05 from a balanced score of 1.0. Side bridge, each side, as compared to extension, should have a ratio of less than 0.75. Evaluation and application of performance for Miguels Torso Muscular Endurance Test Battery. Each individual test in this testing battery is not a primary indicator of current or future back problems. McGill has shown that the relationships among the tests are more important indicators of muscle imbalances that can lead to back pain. In fact, even in a person with little or no back pain, the ratios can still be off, suggesting that low back pain may eventually occur without diligent attention to a solid core conditioning program. Miguel suggests the following ratios indicate balanced endurance among the muscle groups. Flexion and extension, a ratio should be less than 1.0. For example, a flexion score of 120 seconds and extension score of 150 seconds generates a ratio of 0.80. Right side bridge to left side bridge scores should be no greater than 0.05 from a balanced score of 1.0, i.e. 0.95 to 1.05. For example, right side bridge score of 88 seconds and left side bridge score of 90 seconds generates a ratio score of 0.96, which is within the 0.05 range from 1.0. Side bridge, either side, to extension ratio should be less than 0.75. For example, right side bridge score of 88 seconds and extension score of 150 seconds generates a ratio score of 0.59 seconds. Demonstrated deficiencies in these core functional assessments should be addressed during exercise programming as part of the foundational exercises for a client. The goal is to create ratios consistent with Miguel's recommendations. Muscular endurance, more so than muscular strength or even range of motion, has been shown to be an accurate predictor of back health. Research shows that low back stabilization exercises have the most benefit when performed daily. When working with clients with low back dysfunction, it is prudent to include daily stabilization exercises in their home exercise plans. Since most Americans will experience low back pain at some point in their lives, a comprehensive fitness program should incorporate spinal stabilization exercises. Even when working with clients who have yet to develop an interest in the health of their back, core stability should still be a key element in any training program. For example, if the core is not strong, the back may be compromised during a dumbbell shoulder press, creating excessive lumbar lordosis. The same break in position can happen during a squat or a bench press, thus creating excess stress on the lumbar spine. Improper alignment can create a whole host of problems for the lower back, ranging from herniated discs to sciatica pain. Clients' training objectives can vary from rehabilitation or prevention of low back pain to optimizing health and fitness or maximizing athletic performance. All clients will benefit from exercises targeting core stability. Refer to Chapter 9 for more information on training for core stability. Summary. By adhering to the principles of straightening the body before strengthening it, aided by the information provided by the assessments for stability and mobility in this chapter, trainers may witness improved efficacy in their programs and an increased likelihood of success in terms of their clients attaining their goals. Trainers should consider performing the assessments in this chapter in the sequence presented and utilizing them as prerequisites to the more traditional assessments of body composition, aerobic fitness, and muscular fitness.